Hi, my name is Marissa Burnett, and this presentation will cover vulvovaginal candidiasis. Vulvovaginal candidiasis, also referred to as a yeast infection, is a common fungal infection involving the vulva and/or the vagina. It is caused by an overgrowth of an organism in the Candida species, most commonly Candida albicans. Vulvovaginal candidiasis is the second most common cause of vaginitis in women, accounting for about 20 to 25% of cases. Most women, about 70 to 75%, will acquire vulvovaginal candidiasis at least once in their lifetime, usually during childbearing years. About 40 to 50% of women will experience recurrence. Risk factors for infection include pregnancy, diabetes, recent antibiotic or steroid use, AIDS, or other forms of immunosuppression. Vulvovaginal candidiasis can cause severe irritation to the genital and urinary tracts. The classic symptoms include an acute onset of itching and burning of the vulva and vagina. There may also be a non-odorous white curd-like discharge, though this is not always present in all patients. Severe irritation may result in soreness leading to dysuria and dyspareunia. Physical examination may vary between patients. Typically, inspection of the external genitalia will reveal inflammatory changes, including vulvar erythema, edema, and excoriations, as shown in the picture. Like previously I mentioned, there may be the presence of a non-odorous, white, curd-like vaginal discharge on the vulva. However, this is not always present. Speculum examination may reveal plaque-like discharge on the vaginal walls. The cervix, however, should be normal appearing without any lesions, discharge, or evidence of cervicitis. A sample of vaginal discharge should be collected for laboratory evaluation in order to confirm an infection. This includes measurement of vaginal pH and microscopic examination of vaginal discharge. Unlike other causes of vaginitis, such as bacterial vaginosis and trichomoniasis, vulvovaginal candidiasis will not increase the vaginal pH and therefore will be normal, measuring around 4 to 4.5. Microscopic examination of the vaginal discharge, also called a wet prep or wet mount, should be included in the initial laboratory workup. Visualization of budding yeast and hyphae on wet prep of a symptomatic patient is confirmatory for vulvovaginal candidiasis. The images shown are examples of budding yeast and hyphae found on wet prep. The main goal of treatment is providing relief by reducing symptoms. Antifungal agents are the treatment of choice and are available in oral or topical preparations. There are many antifungals that can be used in the treatment of vulvovaginal candidiasis. Some are prescription only, and others are widely accessible over the counter. The first-line treatment is a single dose of 150 milligrams oral fluconazole and is exclusively available by prescription. Typically, follow-up is not required for uncomplicated infections that resolve after initial treatment. Patients with continuing or worsening symptoms do warrant a return visit. Vulvovaginal candidiasis typically has an excellent prognosis as it responds quickly to topical and oral antifungal therapy. In uncomplicated cases, all treatment options have about an 80% cure rate. There are rarely complications involved. There is, however, a possibility of a recurrent infection. As previously mentioned, about 40 to 50% of women diagnosed with vulvovaginal candidiasis will experience a second infection in their lifetime. About 5% of women will experience multiple recurrences. Thank you for listening. I hope this information was useful and expanded your knowledge on vulvovaginal candidiasis.